Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this section, I will be talking to you about how does smoking affect the heart. We know when somebody smokes a cigarette, the cigarette has a content of it called the tar, or nicotine, if you will, and the nicotine has a tendency to displace the oxygen on the hemoglobin. The hemoglobin is present in the red cells. Now, let me make it very simple here. We have red cells in the blood. The red cells have a pigment called hemoglobin, HGB. That's a protein. That's what makes the red cell look red. So hemoglobin, when it carries the oxygen, why? Because hemoglobin has a special attraction towards oxygen. In other words, it's meant for a purpose. Think that red cells are like taxi cabs on a highway. Here's your highway, that's your artery, and this is a non-smoker. So when the red cells or the taxi cabs are running on the highway here, what happens? All the red cells will carry oxygen only. So now you have fresh oxygen arriving at these tissues. Now change the scenario, go to the smokers. What happens to the smokers on this highway? Here is an artery in the smoker, and you will see the red cells, which are supposed to carry only oxygen, HgBO2. Now some of the red cells will start carrying carbon monoxide as well, which is HgBCO, hemoglobin CO and hemoglobin O2. I put them as red and blue here. So now you have a mix of oxygen and carbon monoxide arriving at these tissues. So in a non-smoker, only oxygen is arriving. In a smoker, oxygen and carbon monoxide is arriving. So now the heart does not say thank you at every single beat. Why? Because the heart is not getting enough oxygen as in a non-smoker would. So in a smoker's heart, there will be less oxygen arriving at these cells peripherally. Now remember, heart is supplying the body. So every single nook and corner of the body, all vital organs are devoid of that oxygen that they were supposed to receive. Why? Because of the same reason. The cabs or the taxi cabs that are running all across, say your liver, your brain, your kidneys, they are not getting enough oxygen. So every organ in the body, every cell suffers as a result of this nicotine, which displaces the oxygen of that hemoglobin and replaces it with this molecule called carbon monoxide. So smoking is definitely injurious to health. Heart has to work harder and harder. This makes the heart increasingly inefficient, and at the expense of lesser and less oxygen, it has to continue to work harder and harder. So therefore, the tissues don't get the fresh oxygen in the desired amounts when they should, and they all suffer throughout the body, including the heart. So heart is definitely affected by the smoking, and the rest of the body is also affected, and we'll discuss more in details. So now you have a grasp as to how smoking affects the heart, and I hope you have put down your last cigarette for the good today and will not smoke hence on. So hopefully this should convert some smokers into non-smokers. And of course, go back and see your physicians and see if you can get into a anti-smoking or quit smoking counseling program with them. Thank you for your attention and lots of good luck quitting smoking. Bye.